Cases of irregular periods and PCOS are on an upswing these days. Blame it to changes in our lifestyle or changes in the environment. Irregular periods affect a woman's life in more ways than one. It is physically draining, it is mentally disturbing, and it comes with a bag full of other health complications. Let's take a dive into what is irregular periods, its connection with PCOS, and treatment with homeopathy. Namaste. I am Dr. Sanchita Dharne. Why you should be concerned about irregular periods? Irregular periods is just the tip of the iceberg. It is an indicator of several underlying health issues. Issues such as hormone imbalance, PCOS, fibroids, endometriosis, injuries to reproductive organs, infection in pelvic area can lead to irregular periods. Hence, it is important to deal with irregular periods in a timely manner. When the complications become severe, they lead to issues such as infertility, diabetes, cancer, etc. Let's take help of a simple illustration to understand why irregular periods is an indicator of health issues. Irregular period is an output. It is an output of certain health issues prevailing within your body. Same as any other output, it is also a function of input and a system. If both your input and your system are good, your output is bound to be good. Clearly, there are 4 possibilities. Let's take a look at each of them. Number 1. The input is good and the system is also working well. Number 2. Input is not good but the system is in good condition. Number 3. The input is good but the system is not good. Number 4. Both the input and the system are not good. In scenario 1, when both the input and the system are good, the resultant output is also good. In scenario 2, the input is not good but the system is good. The resultant output can be good or not good. Similarly, for scenario 3, the resultant output can be good or not good. In scenario 4, when both the input and the system are not good, the resultant output is bound to be not good. The system in this case is our body. Our body does the processing of input and gives us the output, and the input comprises our actions. This can range from our lifestyle, our eating habits, our level of stress, etc. It is an oversimplification. Hope it is good enough to drive home the point. What can go wrong with the input? If you lead an unhealthy lifestyle, say you are gorging on the processed food a lot, or you don't get enough sleep regularly, you have a hate relationship with physical exercise, you are indulged in excess of smoking or consumption of alcohol, you are involved in excessive exertion, it can be of physical or mental nature, you are under stress for far too long. All of such things can be categorized into not so good lifestyle input, and they play their part in fueling irregular periods. What about the system? Your body. If anything goes wrong with your body, it does not process the input well. Hence the output is bound to be affected. For instance, if there is existence of cyst in the ovaries, it can cause hormone imbalance and irregular periods. There are other factors which are influencing performance of your reproductive system and hence indirectly contributing to irregular periods. Factors such as insulin resistance, hypothyroidism and abnormal functioning of pituitary gland. From this matrix of scenarios, it is quite clear that if there is problem with the output, that is, if you have irregular periods, there are chances that either one of the input or system has problem or both has problem. In 2 out of 3 cases, there is problem with the system. That means there are high chances that there is existence of issues within your body. Time for you to get a thorough assessment done from your doctor. In this one case, when the system is working well, you are feeding undesirable input to yourself. That means you are involved in unhealthy eating habits, unhealthy lifestyle, stress, exertion, etc. Next question is, what has PCOS got to do with irregular periods? PCOS, which is short for polycystic ovarian syndrome, is an endocrinological issue. It is a growing health problem these days. PCOS directly impacts metabolism and can lead to several other health complications including infertility, hirsutism, acne, weight gain, hair loss, and much more. Hormone imbalance is often associated with PCOS and hence irregular periods is a common feature of PCOS. Strictly technically speaking, irregular periods do not necessarily mean you have PCOS. However, it is an indication that you might have PCOS. As per Rotterdam criteria, in order to diagnose PCOS, at least one more condition among the two is to be fulfilled. One of them is hyperandrogenism and the other is presence of polycystic ovaries. Hyperandrogenism, as the name suggests, is excess of androgen. Look for male pattern hair growth on your body, particularly on upper lips, chin, chest area, etc. This is an indication of hyperandrogenism. Presence of polycystic ovaries can be detected by scans. So, if you have irregular periods, you should look out for these two conditions to rule out the possibility of PCOS. A good number of patients that come to me have different notions about irregular periods. Most of them can be called misconceptions. Let's take a moment to understand a bit about irregular periods. A typical regular period cycle is of 28 days. That said, a tolerance of plus minus 7 days is okay. If the cycle falls within 21 days to 35 days and the menstruation flow is normal, it is termed as regular periods. Quite clearly, if these conditions are breached, it is irregular periods. When the cycle is less than 21 days, you have more frequent instances of menstruation. This condition is called polymenorrhea. In polymenorrhea, the menstruation can be normal. Achieving pregnancy becomes difficult in polymenorrhea. Since each cycle is much shorter in duration, the body does not get enough time for fertilization and eventual pregnancy. Luteal phase, which starts after ovulation, is critical in preparing the body for pregnancy. It is in this stage that the progesterone levels goes up. The endometrial lining thickens in preparation for potential pregnancy. A shorter luteal phase means there is inadequate preparation for pregnancy. This leads to infertility or miscarriages. Although polymenorrhea can occur naturally, it is also an indication of possible presence of issues such as fibroids, endometriosis, polyps, ovulation problems, cancerous tumors, adenomyosis, etc. To sum up, if you have cycle of less than 21 days, you should get an opinion from a doctor and get a complete assessment done. Now, what if you have a cycle with duration longer than 35 days? That means you have less frequent cycles. This condition is called oligomenorrhea. This is quite the opposite of polymenorrhea. In oligomenorrhea, you can have anywhere between 4 to 9 cycles in a year. Oligomenorrhea can be an indication of certain issues such as PCOS, that is polycystic ovarian syndrome, PID, which is pelvic inflammatory disease, ovarian cyst, primary ovarian insufficiency. Infrequent ovulation often leads to chronic anovulation. Achieving pregnancy is hence difficult in oligomenorrhea. There are much more other issues that can lead to oligomenorrhea. There is one more problem that can be associated with periods, and that is complete absence of periods. This condition is called amenorrhea. There are two kinds of amenorrhea, primary amenorrhea and secondary amenorrhea. Primary amenorrhea is when a girl is well past her puberty and still struggling to observe menarche. On the other hand, when a woman who has been having regular periods but suddenly found absence of periods for 3 or more cycles, it is called secondary amenorrhea. Amenorrhea cannot be termed as a disease per se. However, it can be considered precursor to possible health problems such as problem with the ovaries, problem with the other parts of reproductive system such as uterus, fallopian tubes, etc. Presence of PCOS, presence of hormone imbalance, existence of hypothyroidism, problem with pituitary gland, etc. There is one more important aspect to periods which is worth considering. It is menstruation. Menstruation is that particular part of the cycle when the discharge occurs. The discharge comprises partly blood and partly endometrial tissues. It can last from 3 to 5 days. It can vary in quantity and quality both. In normal circumstances, there is a consistency in menstruation of a woman. The number of days is consistent. Even the quantity and quality are also consistent with reasonable deviation. If your menstruation is not consistent, that is it varies in duration or quality or quantity in each cycle, then it can be considered a sign of irregular periods. For instance, you can find that the discharge is scanty at times and it is profuse at some other times. The duration of menstruation varies with each cycle. Consider these as signs of irregular periods. Conditions when irregular periods is normal. It is natural to have irregular periods under certain conditions. Number 1. When you hit puberty, it is normal to have irregular periods for initial 1 or 2 years. Similarly, there is tendency to have irregular periods at the advent of menopause. And number 3, during early pregnancy, you can have irregular periods. When you are using contraceptives for birth control, you can have irregular periods. Why does PCOS cause irregular period in some women? Your body needs a perfect hormonal balance between male sex hormones and female sex hormones to regulate a normal period cycle. The hormone balance can be impacted by reasons like insulin resistance, stress, exertion, hypothyroidism, sudden change in weight, etc. Irregular period is one of the 3 criteria to diagnose PCOS as per Rotterdam criteria. When you have PCOS, you have one or both of the rest of the criteria. That means you have hyperandrogenism, which is excess of androgen. Androgens are male hormones, and excess of it just means that the male pattern is dominating. This has a direct impact to the periods. Other condition that you may have is presence of polycystic ovaries. In this condition, cysts are developed in and around ovaries. Cysts are follicles which are supposed to be disintegrate themselves but remain undissolved in the form of cysts. Ovaries are responsible for controlling periods. Presence of ovarian cysts has an impact on the normal functioning of the ovaries. This eventually leads to irregular periods. In a nutshell, if you have irregular periods, there are high chances you have PCOS. Globally, PCOS is the most common cause of menstrual irregularity and infertility. It is estimated that over 10% women of reproductive age are suffering from PCOS. Prevalence of PCOS is staggering 50% in teenage girls. That just goes to show this menace is only going to grow. In India, according to a report in 2019, it was found that nearly 20% of women in reproductive age suffer from PCOS and a higher number of them are undiagnosed. Lack of awareness is one of the biggest contributors to the accelerating growth of PCOS cases. If you find PCOS symptoms with anybody whom you know, educate them. Let them take timely measures and avoid more severe complications. In one study in India, it was found that nearly 70% women are unaware and undiagnosed of this disease. If their periods are irregular, they might not even consider PCOS as a cause. So, how do you identify if your irregular periods are linked to PCOS? Here are some signs and symptoms of irregular periods due to PCOS. Early signs includes number 1, inconsistent pattern of period cycles. There is constant delays or early arrivals of periods. There is no consistency to the period cycle. Periods with PCOS are hard to keep track of. Menstrual cycles are constantly longer than 35 days or shorter than 21 days. Number 2, period discharge. PCOS affects the bleeding during periods. Though there is no specific quantity of blood you should lose during periods, if you see an abnormal increase in your discharge for consecutive months, this might be an early sign of PCOS. This happens because the uterine lining builds up for a longer period of time before it sheds. Number 3. Similarly, look for scanty discharge. Discharge in minuscule quantity is also undesirable. Number 4. Severe discomfort. Though periods are typically painful in general, it gets even more severe during PCOS. Due to irregular periods and heavier discharge, your period cramps may get even more uncomfortable than usual. Some of the later stage symptoms may include: Number 1. Longer delays. If your periods stop for few consecutive months or if you get less than 8 periods every year, this is a cause for concern. Number 2. Infertility. PCOS is one of the leading causes of infertility because of the constant gap in ovulations caused by irregular periods. Women may later have difficulty in conceiving or they may have to deal with complications after conceiving. Age. Well, if you are in reproductive age, you should look for signs of irregular periods. From 15 years onwards, it can develop at any age. Most women are not too concerned with irregular period patterns, so many women are diagnosed at a later stage. If there is history of PCOS in family, you should be extra vigilant. Home remedies to manage irregular periods due to PCOS. There is nothing better than managing PCOS naturally. Adapting a healthy lifestyle, embracing healthy eating goes a long way in managing PCOS. First up, if you are burdened with overweight, shedding just up to 5 to 10% of your whole body weight can help you witness some early wins in your battle against PCOS. Regular and moderate exercise helps you maintain a healthy weight. Couple it with controlled diet, and you can witness accelerated relief. Many researchers have shown that losing weight improves dysmenorrhea, painful period cramps, and makes the periods more regular. Talking about food, stick to seasonal fruits and vegetables. Reduce sugar intake, avoid processed food. Certain specific food items are greatly impactful, such as ginger, cinnamon, pineapple, papaya, and turmeric. They have anti-inflammatory properties. You should make them part of your daily diet. Cinnamon, in particular, is even proven to be effective in regulating periods and helping with cramps. The benefits of vitamin D are wide-ranging. Most of us don't know that a lack of vitamin D can contribute towards irregular periods. In a study conducted in 2015 on 77 participants, it was found that there is a direct link between vitamin D deficiency and irregular periods. It was found that women with oligomenorrhea and amenorrhea had significantly lower vitamin D concentrations than women with regular cycles. Potential risk and complications. Irregular periods, if not managed on time, can potentially lead to much severe complications. Infertility. Irregular period is one of the primary causes of infertility. Even if you are able to conceive, the road ahead can be far from smooth. Women with irregular period patterns are more prone to having miscarriages or giving premature births. Also, irregular periods cause layering of uterine walls. These can lead to constant abnormal uterine bleeding during periods and can potentially lead to endometrial cancer. Irregular periods also impact the bone density. Women with irregular periods are more prone to heart-related disease. The risk of irregular periods also extends to psychological damage. Stress arising due to irregular periods can cause mental disturbance. The sleep patterns can get disturbed too. How does homeopathy treatment work in cases of PCOS with irregular periods? Homeopathy treatment has been proven to show lasting results in managing irregular periods and PCOS. Homeopathy primarily focuses on fixing the root causes attributed to the problem. It focuses on restoring the normal menstrual cycle, restoring the hormone balance, and regularizing ovulation. Success of homeopathy treatment of PCOS with irregular periods. Homeopathy treatment has shown to have a high success rate in delivering treatment for PCOS symptoms, including irregular periods and infertility. A study was presented by Dr. Deepak Sharma in second International Conference and Exhibition on Traditional and Alternative Medicine in Beijing, China. As per the study, 132 patients of PCOS who were otherwise not being treated were delivered homeopathy treatment. 91 of them, that is close to 69%, were successfully treated. Others were either showing improvement or opted out of the treatment, and just 4 were classified as difficult to treat. In my own clinical practice, I have witnessed complex cases of irregular periods. With regular homeopathic treatment, they have been able to successfully overcome the problem of irregular periods. While treatment of any PCOS case, typically it is my first priority to bring the periods to normalcy. It paves way for the successful treatment of rest of the problems. If you have found this coverage useful, please press that like button. This motivates us in bringing more such videos. I have tried to cover most of the common and basic information pertaining to irregular periods. Being aware of these basics is your first step towards reversing PCOS. If you have any questions regarding irregular periods or PCOS, please ask in the comments box below. Our team will try to answer them as soon as possible. It's time to call it a wrap for now. Stay healthy, stay happy.